Hey family, let's chat GLP-1s. We're doing all things GLP-1s. It's been a minute, but all right, those who are joining on our other social media, let's chat all things GLP-1s today. I'm Dr. Jade. For those of you who are joining, I am joining live from Inspire Primary Care in Las Vegas. As you join, drop in the chat, where are you joining from? This is one of our favorite talks. Last time I went on and we talked about GLP-1s, you guys lit me up with the questions. And I asked you if you wanted a part 2. You said yes. It's been a minute. Y'all said I got a question. I'm looking at you guys joining the chat. Okay, I'm joining live from Vegas. You know I like to know where you're joining from. Create Me LV says, hey sis, I'm here. All right, y'all, if you're looking for an amazing event planner, you got to check out Create Me LV. That's my sister. And then we have Gorda y Flaca. Come on now, you know I know a little Espanol. All right, it says, hey, I got a question. Drop it below. As we go, I'm gonna, I have, some things, some popular questions. I asked you guys in my stories, what questions do you have about GLP-1s? We are launching a new Inspire GLP non-membership program because you guys have been asking me for this nonstop. And also mostly because it's been some unsafe things happening throughout the valley. We've been actually taking care of a lot of people who have been going to the different online websites, the popular websites that celebrities are promoting. People have signed up with those and they're having side effects, some pretty serious things happening, and they've been joining our practice so we can get them back on track. And so I don't want you guys doing things that are unsafe. So we're creating an option to meet you where you're at if you are not, doing what I really recommend, which is the primary care along with the medical weight management. But if you're like, look, doc, I just need the weight management right now, I'm gonna hold off on the primary care, although it's not recommended. I at least want you to be doing the medical weight loss part safely, okay? So drop in the chat what questions you have. We're going to be talking all things GLP-1s. I'm going to share with you the top most popular questions I've been asked, and I want you to know just some things to look out for as you're looking at, GLP-1s and healthy weight loss. This is all about health, okay? Let me take a beat. I got so excited to come on and see you guys and talk. I haven't even introduced myself to those who are not familiar with me. So if you're new here, I'm Dr. Jade. I'm a board certified family medicine physician. I am specialized in obesity management and medical weight management. I specialize in prevention, lifestyle medicine, helping people transition to a healthier lifestyle and a healthier weight with concierge style quality primary care at their fingertips. So that's what we're passionate about here at Inspire Primary Care, not just losing weight, but being a healthy weight that helps decrease our chronic disease burden and allows us to age well. All right, we're talking longevity. We want to be a healthy weight to keep our chronic disease burden down. It makes all of the primary care things easier as we age as well. And being a healthy weight just is tied to almost every chronic disease. So I'm really passionate about that. And it's a pleasure to serve in my hometown, Las Vegas. All right. And if you've been looking for quality primary care or medical weight loss services or hormone management services, then Inspire Primary Care is your home. And we would love to care for you. You can just text Team Inspire to learn more or to enroll. We're at 702-867-0017. I know I talk fast, so 702-867-0017. Drop in the chat, where are you joining from? Okay, are you in Vegas? If you're in Vegas, this is your home, all right? All right, so let me scroll the chat because we've been hearing some nightmare stories about people signing up on these online weight loss websites and getting, quote unquote, watered down medications. They're not sure about the medications. They're scared to inject medications and they don't know where the pharmacies are. They don't know their provider team. They're like texting an app and, some people are having side effects and then they can't reach anybody. People have been telling us about hidden fees. They sign up for this really discounted fee that sounds really good up front. And then down the road, it's like this inflated fee. So I've heard all the things. And so I don't want you guys to be doing things. Mostly safety is my biggest concern. I want you to be safe. These are medications that need to be monitored by a physician that knows you, okay? Lab work should be done. Your health history should be known. Your family history should be known. You should know the quality of the medication, the pharmacies it's coming from. Do they have a sterile lab? I'm gonna go through all of this, okay? So many things. It's more than just what's cheap, what's online, let me order this. No, please, 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 please. This is going in your body, all right? So we want to think about this, all right? All right, so let me scroll the chat. because those of you who are here, I want to prioritize you. So I want to answer the questions that you drop. All right, so New Jersey's in the house. So Salude Vida Medical Spanish says New Jersey. So welcome, New Jersey. We got the East in the house. We got Las Vegas in the house. I'm scrolling the chat. All right, something about a person who's been throwing up since weeks. Okay, so Gorda y la Flaca says something about a person who's been throwing up since weeks and he's losing weight. So I'm going to try to sift through what I think that is saying. It sounds like whoever you're talking about is having side effects from the medication, and vomiting can be a common symptom of this medication if it's not properly managed by a physician that specializes in medical weight management. My patients very rarely have vomiting, and that is because I, one, assess their health history. I'm getting their physical exam, their vitals. I know their health history, right? So then I'm prescribing a specific dose that's going to be customized to them as an individual. A lot of times people are going to like the cheapest place, an online place, or like weight loss clinics that are really just like taking your money, giving you a shot. Like there is no primary care assessment along with it. And if you don't do it that way, a lot of times I've even heard this, a lot of people are also starting people at higher doses so that people lose weight faster and refer more people. So then they get all this flood of people coming in, they're losing weight faster, but they're having higher side effect profiles. So I like to remind people that GLP-1s are FDA approved for medical weight management, and people have very low side effect profiles in general when it's prescribed correctly by an expert, right? And so when my patients join, and one of the questions people want to know is like, how fast will I lose weight, right? And I tell people everyone differs, right? Some people lose a lot of weight up front. Some people it's spaced out over 6 to 8 months. But I tell people, like, based on the studies and what we see in our practice, when we look over 12 months, typically 6 to 12 months, most people are going to lose 15 to 18% of weight loss, okay? And so it can go faster. It can go more than that. It can go slower for some people up front, but it's really not about the speed. It's about how long you can sustain it, because you don't want to just be paying for something for 2 to 3 months, lose all this weight, then you're just using this, what can be a healthy tool if used appropriately, in an unhealthy way, which is just a yo-yo dieting way. So GLP-1s can be used appropriately or inappropriately, just like everything. It can be prescribed in a way that leads people to higher side effect profiles. It can be prescribed in a way that's customized to the individual, decreases side effect profile, allows a healthy nutrition plan and a healthy lifestyle plan along with this tool to help transition weight. That is how we do it at Inspire Primary Care. And then you have what we have at our practice is people that have lost over 100 pounds, have reversed, high blood pressure, cholesterol, type 2 diabetes, all of that has now been reversed, and they've maintained over 100-pound weight loss for over a year, right? It has now become a lifestyle. So we don't do our program in a way where it's a fad diet. It's not meant to be that. It's meant to be an ongoing health, transformation. So to answer your question, Gorda y la Flaca, the questions I would have for them is, who are they seeing? Is the person they're seeing specialized in medical weight management and obesity medicine? Are they being monitored for the primary care and metabolic workup as well to make sure that they don't have any other health history? Has their lab work been done? Have their vitals been done? Has their physical exam been done? And are they seeing someone who knows how to appropriately manage side effects when side effects are happening? So some of the weight loss clinics, they know how to prescribe the medication to get people to lose weight, but some people are not trained in how to manage side effect profiles. That's important, right? Just like some clinics are not trained in how to help it be a long-term sustainable weight loss. They don't have a maintenance phase in their program, only a weight loss phase. So those are questions I would have for the person you're referring to. So thank you for that question. That's a great question. Okay, I'm scrolling the chat, y'all. I'm scrolling the chat. Y'all can see I'm excited. All right, let's see. Okay, so Saludes Vida Medical Spanish says we are having difficulty getting them approved. That's not by accident. So I try to educate on this. Weight loss medications like GLP-1s are at the time of this recording, they are mostly a cash industry. Most insurances do not cover them. And even if they're on your medication plan for your insurance, if it's listed there, there's a lot of fine print to it. So meaning, for example, I had a patient join and they were like, hey, can you send this to this specific pharmacy? My insurance says it's covered on there. And I'm like, okay, I just want you to know it's not covered, but we will try for you. What she ended up finding out is what I already knew. One, it is FDA approved. In addition to for weight loss, it's also FDA approved for type 2 diabetes. So the requirement was they had to have type 2 diabetes, but not just that they had to have type 2 diabetes. Pre-diabetes does not qualify. Okay. So not only did they have to have type 2 diabetes, they had to have a hemoglobin A1C over 7%, and that wasn't enough either. They also had to be on a nutrition program documented by a physician for at least 3 months. They had to be on metformin, which is a medication that's very inexpensive, oral medication for diabetes, for at least 3 to 6 months and titrated up to the max dose. And then they could resubmit to see if they were approved. I have had many patients go through that whole process, which that whole process ends up taking 6 to 12 months and then still being denied by insurance on the back end. So I try to save people all of the headaches and frustrations and just letting them know at this time insurance does not pay for it. It's very rare scenarios that it's paid for. Every now and then in different states, I'll hear somebody say, my cousin got it paid for. I'm just letting you know what the experience has been in Vegas. We're happy to process it through people's insurance so that they can try, but I've done this enough times for enough years to let people know that insurances at this time do not pay for it. So because of that, we have the name brand, which are more pricey, and we also have the generic options, which are more affordable. So most of our members do utilize the generic options because they're more affordable. Now with that though, it's lean in. This is important. Hear me when I say, because it's so important. If your physician or your medical team is prescribing you a generic, which all of these online places that you're that are popularized right now, they're utilizing generics, right? They put their label on a generic, right? They're white labeling it. So if your doctor is giving you a generic prescription, lean in. Let's take a beat. I want you to hear me. It is important to know about the details of the safety of that pharmacy. What you have to know is I don't play about my medical license, right? And so I personally toured all of the compounding pharmacies in my region. I toured the facilities. I toured to make sure they had sterile labs. I interviewed the pharmacists. They let me put on the white coat in the sterile lab and go through the procedures that they use for safety. They let me know the vendors that they're getting the medication from and the procedure, how they're shipping it, what temperature. This is information I needed to know to be comfortable utilizing my medical license for generic medications. You have to ask yourself, is that happening where you're ordering your medication? Because not all pharmacies are equal. Not all pharmacies have sterile facilities. Not all pharmacies are giving you the medication with nothing else added in to make it more quote unquote watered down, which is going to affect the side effect profile and your weight loss results. So I have a trusted source that is the only source I use for my members. And that's important. So when you think about having difficulty getting them approved, if you're going to utilize generics, please don't just order for somebody that is saying that it's really cheap here, because you have to ask yourself why. Why is this so much cheaper here? And the answer is there's answers to that why, and I just gave you some insight behind that. Safety is important, you guys. Safety is important. Okay. Thank you for that question. Salude via medical Spanish. I appreciate that. I'm scrolling the chat, you guys. This is always really interactive. Okay. Drop in the chat where are you joining from. We're talking all things GLP-1s. If you have any questions, drop them below. I'm scanning the chat. All right. Let's see. All right. So, yes, gorda y flaca, you said whenever this person is eating, they're throwing up. You don't know why. So I kind of went over that. We got to get him in with a specialist, someone who specializes in medical weight management. That is a physician-led team that specializes in medical weight management. Very important, okay? Because these can be easily I mean, that's not a side effect that would scare me because I'm specialized in that, so I would know what to do next. So really important that he's seeing somebody who knows what to do next, okay? And how to appropriately screen. Get him connected. If you're in Las Vegas, then that should be Inspire Primary Care. But if you're not in Las Vegas, you want to get connected with someone who specializes in medical weight management. Okay. Okay, I'm scanning the chat. I don't see any more questions right now. And so I'm going to let you guys know the questions that were asked, okay? If you're new, I see some people who just joined. Drop in the chat. Where are you joining from? It says, just tuning in. Hi, Jade. Where are you joining from? Where are you joining from? And we're chatting all things GLP-1s. Drop in the chat any questions. I'm going to let you guys know the top 3 things to know when it comes to GLP-1s with what's going on, lately. All right. So let's go through those. All right. Many people are paying online to the online websites for weight loss. I won't say the names of the very popular companies, but we're all familiar with them. They're using celebrities to promote them. And there's 3 things I noticed that we just want to be on the lookout for. All right, you ready? Number 1 is it is a red flag to have an unknown provider. It is a red flag to have an unknown provider and medical team. So what does that mean? What that means is when you join Inspire Primary Care, you know that Dr. Jade is the medical director and that is your physician, right? You know that Noelle is your nurse practitioner. You know that Ilani and Michaela are your clinical support team. You know where your medication is coming from. You know that I've already let you know that I've toured the facilities. I know the pharmacists personally, and they have sterile facilities. So you know what you're getting, you know the quality that you're getting, and you know who you're dealing with, and it's local, right? It's not like it's an app. It's not like it's some pharmacy from overseas. So a red flag is not knowing your provider. Many people are signing up online, giving their card, getting medication shipped to their door. Our practice also ships the medication right to your door, so still convenient, right? But they have no idea who's managing their medications. They have no idea, about anything. And the providers don't know who they are either, and they don't know their health history. So that is a red flag, you guys. It's important. If somebody's prescribing you something, they should know you, and you should know who they are, and they should be accessible to you. Let me scroll back up. Gorda Eve Flaka was saying that, the person prescribing this medication to the person she's referring to is having some severe side effects right now and should probably go to the hospital based on what you're saying. But they have no idea. It sounds like who their doctor is or how to reach them. They can't get in. Inspire Primary Care, your team's a text message away. We have a local office that, we'd have you come in if you're having side effects. We're a text message away. So, and you know who we are. So you just want to know your provider team. Will you promise me that you'll at least sign up with somebody where you know the provider team? And if you're in Las Vegas, Team NSPIRE would love to care for you. All right, the next red flag number 2. Red flag number 2 is there's no lab work, there's no relationship, and it's unmonitored. This is a red flag. If you are signing up for a medical weight loss program and they're not asking you detailed history about your current medical history, your past medical history, your surgical history, your family medical history, if they are not getting your vitals, if they're not doing a physical exam, if they are not ordering lab work and at least screening for other metabolic diseases like type 2 diabetes, high cholesterol, we need to know these things, right? Because is your weight loss tied to your thyroid, your weight, the inability to transition to a healthy weight? Is that due to you having hypothyroidism? Is that due to Hashimoto's disease? Is that due to lupus? Is that due to sleep apnea, undiagnosed sleep apnea? Do you have hypertension that you have no idea about because most people are asymptomatic and have no symptoms? These are things that are so important when we're talking about transitioning to a healthier weight. We gotta look at the full picture, the full person, the lifestyle, the prevention, the chronic disease burden. Please, for you, for me, for the community, all right? Consider joining a place, if this is the right fit for what you're trying to do in your season, if you're trying to transition to a healthier weight, joining a place where you have a relationship with the team and they're monitoring and doing lab work and screening for other health concerns. Okay, really important. So that's a red flag that I'm seeing as well. People are coming in and they're establishing with us after they've done these online programs, and they're like, oh my gosh, they didn't even tell me I had sleep apnea. Oh my gosh, they didn't even tell me that my high blood pressure is because I have uncontrolled sleep apnea. And they didn't even tell me that that could be related to, cortisol levels, and that could be related to adipose tissue and my inability to lose my gut. Medical terms, but you know what I'm saying? Like, these things are interconnected. It's not just, I want to unbig my back. Okay. I'm down with the lingo, y'all. So it's not just that. It's not just I want to be snatched, but there's more to it, right? We want to look at the whole picture. All right. And then number three red flag is, which I've already touched on this a bit, but I want to emphasize, all right, is the unknown pharmacy. It's the unknown pharmacy. If you don't know the pharmacy that these medications are coming from, if you don't know that they're U.S. local based, if you don't know that they have sterile facilities, it is a red flag, okay? That makes it less safe. And you're talking about injecting yourselves with medication. This is a tool, GLP-1s have been a tool that I am excited about because it can help decrease chronic disease burden when utilized safely. It can help people transition to a healthier lifestyle, a healthier weight, and maintain it when utilized correctly under the direct supervision of an expert. All right. And so those who are doing it correctly, right, and those who have joined Inspire Primary Care, have reversed chronic disease, transitioned to a healthier weight, are maintaining it, have a relationship, we're a text away. And I'm really proud to have a practice that when people have joined our practice, their lives have become healthier. Like, that is something I'm really proud of, including myself. I'm very transparent that, after my second baby, I gained 60 pounds. I was eating healthy, working out, doing marathons, and the baby weight would not come off. I put myself on our weight loss program, and, I am working out every day. I'm eating healthy, but I'm also in the maintenance phase of our weight loss program, right? And I feel amazing, and my labs are beautiful, and I'm proud of that, right? Because it's something that, I want to practice what I preach, right? I want to be able to run around with my kids and see them grow older. And I know that that's what you guys want too, is to feel your best and age well. I think all of us want that. So I'm passionate about that. Cheap does not equal safe. All right. That's a little nugget I want to leave with you. Some of you were asking in the chat, well, tell us about the Inspire GLP program. So again, at the top, I kind of said, we always have, our practice is a membership medical practice. We have 3 main tiers to our practice. Inspire Virtual is unlimited concierge style primary care virtually for those who don't really need in-office appointments or a lot of referrals. We have our standard membership. So that's our most affordable membership. We have our standard membership, which is our most popular. That's Inspire Concierge. That's going to include the scheduled appointments. That's going to include in-office visits, in-office procedures, including the pap smears that I'm about to do after I get off this live. And that's going to include us doing referrals and care coordination. So that's our most popular plan. But then we also have Inspire Specialty. And Inspire Specialty is all of your primary care and medical weight loss and hormone management all wrapped in one. So that's our most comprehensive plan. So we've got you covered. However, you guys have been asking me like, well, Dr. Jade, I really don't want a membership, and I love you. I want primary care, but what I want the most right now is that shot. Like, I get it. I'm meeting you where you're at. So we have launched Inspire GLP, which is our non-membership program for those who really are not in a place where they're ready for the primary care yet. You can feel free to upgrade later, but it's a membership free option where you establish with us. We still do the lab work. We do the initial consult so that we know your health history. We've screened for other things, and then you order as needed and pay as needed. Each time you ask for a refill, that's when you would pay. So it's a membership free option that just allows for a safer way for you to access GLP-1s instead of utilizing online platforms that are just not as safe. Okay. So I hope you guys take advantage of that option. If you want to learn more or you're thinking about enrolling, you can text our team. You can text Team NSPIRE at 702-867-0017, 702-867-0017. We're still making it convenient. Medications come to your door. We're making it safe, all right, and we're making it local, where your team knows you, and we're right around the corner, all right? So I'm going to scan the chat, see if anything else has come up. All right, I'm scanning the chat. If you have any questions, y'all, I have a minute before my next appointment, so I'm gonna take a beat and take a sip of my tea. Don't y'all love my new? I'm loving the new logo. So I got the logo on everything now, right? So I'm gonna take a beat and have some tea. But let me see. Scanning the chat, not seeing any new questions here. All right, Ronald Gaines. Hi, says you are doing a great service. Really, really proud of you. We went to high school together, so thank you so much. I appreciate that. Let's see. Cash Chi Long says it's Cash Chi. I'm in Charlotte. So shout out to Charlotte, North Carolina. And you're the owner of Long Health and Wellness. So I think she has a wellness center in Charlotte. So amazing. All right, you guys, I don't see any more questions. You guys, this is always, we're going to continue the conversation. So I'll come back. I'll look in the chat. If you have other questions that come up, if you're watching the replay, drop it for me and I'll come on and I'll interact. If there's lots of questions, you know, we can always do a part 3 and come back. But stay tuned because we've got to go in. We got to take a beat from the GLP-1s after today. And next week when I come live, we grab your tea, grab your pen, because we've got to talk about open enrollment season. There are some huge changes coming down the pipeline with legislation. There are things you need to know, okay? I'm going to just give you a little snippet, is that 60,000 Las Vegas families alone are going to become uninsured. 60,000 just in Las Vegas. And so there are some huge changes that you guys need to know about. We have solutions and ways to help, and I want to help educate on what to expect coming down the pipeline and how you can be ahead of the wave that's happening. And so Inspire Primary Care is always here to be a resource. And thank you guys for joining me and being so interactive today. If there's any other questions, drop them, DM me, text our team, right, at 702-867-0017. We're at inspireprimarycare.com. No I in front of Inspire. And it's always a pleasure to serve you guys. See you later. Bye.